This program is brought to you by thepodcastfactory.com.
How would you like to get more customers, make more profits, and have bigger breakthroughs? Get Doberman Dan's profit-boosting breakthroughs. Normally, this would cost you $98 per month. But right now, for listening to this show, he's giving you a free copy of his Doberman Dan letter. All you have to do is go to DobermanDan.com and sign up to get your free copy now.
Prepare yourself for the uncensored, nothing held back, no BS reality of how business and life really work. Doberman Dan is off the chain.
Welcome back to another edition of the Off the Chain Show. We're going to pick up where we left off with Doberman Dan interviewing Dr. Kenny on ADHD. So let's jump back into it.
For me, having ADHD has its challenges and has its strengths, and it's just as much a part of me as having brown hair, and it really doesn't matter. But then again, I was diagnosed as an adult and as a psychiatrist and an expert in ADHD. Like, I can take it, I can handle it. Nobody's going to throw me off by making a comment, right? Where it's different for an 8-year-old, 10-year-old, or parents, right? So I help them to understand what it is. I talk about the fast brain with bad breaks. I help them to understand that they're creative and there are, gifts within if you can work on them. In fact, I had a kid in my office yesterday who was a 10-year-old who said, I think of my ADHD kind of like a superhero with their superpowers that not everybody knows about, right? And, he's incredibly creative and a great kid who draws very well and has a whole bunch of strengths. And I just thought that was a wonderful way to look at it, right? Better to grow up that way than thinking I've got a mental illness and I'm weird and I'm different than everybody, right?
For sure. I like that attitude. That's cool.
Yeah. So the mindset's very important. And so there's that. Then we have to talk about treatment. And treatment really needs to include a whole range of things. So there have to be school strategies, behavioral strategies, parenting strategies for parents of kids or teens. For adults, they have to work on coping strategies and, things to help them at home and work and money management and things like that. There are a whole number of natural treatments which can be helpful. Most doctors do not know much about them or pay much attention to them, but they can certainly be a good approach. And then medicine plays a role, and medicine can be very helpful. So that's also a consideration.
It seems like my generation, maybe even my parents' generation, we were kind of conditioned to, I have this problem and I want the instant cure. And so that's always demanding the magic pill. But it sounds like there's no magic pill. Medication may be helpful, but there's a whole host of other things that need to be implemented too.
Absolutely. Well, so ADHD medicine works pretty well. If somebody's got the right diagnosis and they're working with somebody who can monitor and make sure, they're prescribed for properly, there's about an 80 to 85% chance there's a good or very good response. And at the same time, there's a 10 to 15% chance of side effects that are bad enough you need to stop the medicine, right? So it's not perfect, but it's good odds. But when you have a good or very good response, that doesn't mean everything's okay, right? So, I mentioned paperwork is my kryptonite. When I got diagnosed, I tried a whole bunch of things and I use a whole bunch of strategies, right? I do work with a coach. I work on my calendar and scheduling and all these sorts of things. I exercise regularly. I eat a pretty darn healthy diet, make sure I get enough sleep. The exercise helps with mindfulness and relaxation, all this stuff. And still taking the medicine and doing all these things, the paperwork piles up, I had to learn better strategies about managing my calendar, managing my to-do list, dealing with paperwork. And I won't say I'm perfect. I'm improved significantly, but by no means am I Mr. Great at paperwork, right? So people have to learn skills. And in the ADHD coaching community, which is a branch of life coaching or executive coaching, they have a great saying that pills don't teach skills. So you can start a medicine, it can help you focus, but that doesn't mean all of a sudden you're organized or you can manage your calendar or be on time for things. You still have to learn how to do that stuff.
Right. Help me understand, because it seems contrarian. College kids like taking Ritalin because for the boost, because they can stay up later. So
sure.
To me, that seems contrarian. Like I even mentioned to my sister, because one of my nephews is ADHD, and I told her that this makes no sense. Like, shouldn't you put the kid on downers? And she's like, oh, no. So would you help me explain how the medicine works? Because it seems like something that speeds up people would have a bad effect on somebody with ADHD.
For sure. So, and this is one of those things that's out there that's confusing and doesn't make a lot of sense. So the history of the term stimulant, it comes from the fact that I think it was in the early 50s, actually, they gave very high doses of this medication to rats in a lab, sort of at about 20 times by weight what we would give a human with ADHD now. And these rats got very stimulated. Now, if you gave a kid or an adult 20 times the dose of what they should be taking for ADHD, we would get pretty stimulated too, right? So that's where the term stimulant came from. So it's not that it makes you more hyper, and it would if you don't have ADHD, and it calms you if you have ADHD or things like that, which is commonly out there. So it just comes from this historical term. The way I like to explain it that makes sense is these medicines actually stimulate a couple of brain chemicals, dopamine and norepinephrine, or noradrenaline, that are little chemical messengers between neurons, and they help to boost those chemicals that boosts the signal. And the way it works is norepinephrine helps to increase the signal. So if you boost norepinephrine, the signal is louder. And when you increase dopamine, it helps to dampen the noise. So if you think of in the old days with a car radio, not a digital one or a satellite, but like one of the one with the little red dial that you turn and you try and get through the static to find a signal. Back in the old days when we were driving out in the countryside and there were no DVD players or iPads or whatever, and you're out in the country with your parents on a long drive and you want to hear a radio station, well, when your dad's driving and turning the dial, to hear well, you have to have a strong enough radio signal and you can't have too much static. And if you have one but not the other, you just can't enjoy the radio station and can't hear it well. And that's what happens with ADHD. So if we can boost dopamine and norepinephrine, we increase the signal, so it's easier to pay attention to your math homework or your, copywriting or whatever it is. And when you increase the dopamine, it's easier to dampen the noise around you, so you're not as bothered by, the noise outside the window or somebody talking on the phone in the other room. And so that's what the medicine does. It boosts the brain chemicals so you can focus better.
I'm glad you explained that, because that was always confusing to me. I never understood that. And I guess it's like anything else. I mean, as part of a strategic treatment plan, it's helpful in clinical dosages, but obviously, people who abuse it aren't using the right dosages.
Yeah, absolutely.
So your book is called Attention Difference Disorder: How to Turn Your ADHD Child or Teen's Differences into Strengths. You've been sharing a lot of stuff, but can you share a tip or two out of the book?
For sure. So, the concept of attention difference is essentially that we focus differently. It doesn't mean we can't focus. We just focus differently. And I've been talking about that earlier. And this can lead to hyperfocus, right? Where, when somebody gets tuned into an activity they have to get done, whether it's a project that has to be finished or, let's say a copywriting project or, whatever, new product or whatever, when the pressure's right or the energy is high or the motivation is up there, we can hyperfocus and, ignore everything else for hours upon end and get it done incredibly well. Technically, a neuropsychologist would say that's like a neurological problem. It shouldn't be working that way. I just think of it like my young patient said yesterday, this is one of my superpowers that I can use sometimes, and it's incredible. I think one of the main things about the book is it's 7 steps, right? So this is a book for parents of kids and teens with ADHD. And really, we need to look at all aspects. And I set up 7 steps so that it kind of helps people orient to it, because sometimes people go from crisis to crisis, right? A parent of a kid or teen, like school's a problem, we need to deal with school, right? Or an adult with ADHD, my relationship's falling apart, or I'm losing my driver's license, I got to deal with this, right? But we have to remember the forest for the trees and pay attention to the whole big thing. So the steps are to get educated about ADHD. You need to know what it is, how it impacts people, how symptoms can come up in individuals. Second step is making sure you have a proper assessment and diagnosis, right? No 5-minute assessment and take a prescription. That's, like I said, malpractice. The third step for kids is parenting for ADHD. And that's critical because parents help to support kids in all the different environments. Think of a kid with diabetes. The parent knows how to manage it, and they're going to tell the soccer coach what to watch for, and the friend's mom when they go to sleep over to what to watch for. Then it's So parenting strategies, then school strategies, then medication is the fifth step. Sixth step is alternatives for ADHD. And the seventh step is treatment integration, which is adjusting over time. For adults with ADHD, my approach, I haven't written a book about it yet, but my approach is much the same. Education for ADHD is step 1. Proper diagnosis is step 2. Work strategies is step 3. Relationships is step 4, because ADHD can do a number on relationships. Step 5 is medication. Step 6 is alternatives. And step 7 is, again, adjusting over time, treatment integration, or dealing with the coexisting conditions. So that's the overview.
What would you say to somebody who is listening to this and they're like, oh my God, everything he's just described, I'm having that experience, or that's me, or, oh my gosh, that he just described my son. What would you say to them? What recommendations would you make?
Apart from buy my book? No, I'm just joking.
We're going to talk about that in a second. Yes.
Yeah. So, no, honestly, it's worth talking to the doctor. Make an appointment for your kid with your family doctor or pediatrician. If you're an adult, with your family doctor, and look for an ADHD assessment. Now the real difficulty, there are many family doctors and even many adult psychiatrists who don't believe in ADHD. And this is what drives me crazy, right? Like, you figure this out, you deal with the whole emotional thing, you decide, okay, I'm going to investigate this and figure it out, and I want to try and get some help. And you go to the doctor, and the doctor says, oh, it's probably just depression. Here's an antidepressant. Don't worry about it. Or that's kid stuff. It doesn't apply to you. Don't worry. Well, like 70% of kids with ADHD still have it as adults. But it really wasn't until the mid-90s that the research was showing this carried on beyond 18 years old. So I trained in the mid to late 90s. Like, we weren't really even training in adult ADHD at that point. And I got a lot of ADHD training. Most doctors don't. So not a lot of people know about it. So people have to be persistent. You have to find the right doctor. And sometimes that may mean finding the local or regional medical school, calling the Department of Psychiatry and saying, who do you have here that's doing work in adult ADHD? Because even if there aren't doctors in the community, most university centers at this point have adult ADHD work going on. And then I know in the US, there's the whole thing about your insurance, and you may have to pay because it's out of network and this and that and the other. And I don't think Obamacare fixed it. I don't know, but anyway, we'll leave that. We'll leave that aside for now. But anyway, so yeah, people should get an assessment, and it's worth reading more about it, right? To figure out what it is. I do have a podcast at ADHDpodcast.com. There's plenty of other podcasts or, audiobooks or, paper books, other things like that can be helpful.
Is drkenny.com the best way for people to get more information about you?
Yeah, absolutely. Yeah.
Okay. So that's drkenny.com. And your book, Attention Difference Disorder, is that on Amazon?
Yeah, it's on Amazon, Barnes & Noble. It can be ordered into a bookstore, a physical bookstore. In Canada, it's in our bookstores. I don't know that it is in the States.
Okay. But by the way, forward by Dr. Edward Hallowell, who is also another world-renowned expert in ADHD.
Yep.
And it speaks to groups of entrepreneurs about this, if I'm not mistaken.
Yes, he does. Yeah.
So cool. Well, I know you've got to run, so I want to thank you for your time today, and thanks for clearing up all the misconceptions that I spewed out to everybody.
Well, listen, I really appreciate you having me. It's very kind of you, and I appreciate the opportunity, and I really respect that you gave me the opportunity. I do want to say, because this is, a unique issue, and you may have people on your list who either know they have ADHD or suspect they have ADHD, or sometimes people figure out they have ADHD when their child is diagnosed and they start reading about it and kind of realize this is them too. I wanted to make available to the people who listen to this, at least for the first 25. I have a coaching session that I've done with an ADHD coach about overcoming procrastination for adults with ADHD. So if people want to go to drkenny.com/business, they can enter their information and I'll send you the CDs and you can check it out and it'll be helpful. So I'll do that for 25 people if they want to. So depending on when you're listening to this, it may still be there, it may not. And I'll also do an audio. I was thinking about this, that sort of how do you know if you have adult ADHD? So just addressing a little bit more some of the specific things you can look for. And that'll just be a digital download that people can get.
Wow, thanks. I appreciate you doing that. I'm going to assume that this is something that doesn't just get better. Like, I know a lot of people with certain conditions just put it off, thinking that somehow it's going to get better. I have to assume that that's not the case. If somebody's recognizing that they have this is something they really should get an assessment for.
Yeah, it's not really going to go away on its own. It could be less problematic if, a whole bunch of stress calms down, but sometimes to help your stress calm down, you got to find the solutions to the ADHD, right? So it just depends on the individual, but it doesn't go away on its own. It's there.
Well, again, Dr. Kenny, thanks a lot. I appreciate you being on the show.
Thank you so much for having me. Thank you, Jonathan.
And what was that URL just one more time?
Sure. It's drkenny.com. So drkenny.com/business.
There you go. drkenny.com/business. Thank you, Dr. Kenny, for setting us straight. Thank you, Doberman Dan, for being a sport. And thank you, Canine Crew, for tuning in. We'll be back in your earbuds next time. Thanks for listening. And remember, if you want to create rivers of revenue from your existing customers, then the next thing you need to do is go to DobermanDan.com. He's given away a free copy of his $98 per month Doberman Dan letter just for listening to the show. Go to DobermanDan.com now and sign up for your free issue.
This is the podcastfactory.com.